Good morning or afternoon, depending on where you're located. My name is Karen Yarussi King, and I would like to thank you for attending my presentation and for the opportunity to speak to you today. My goal is to provide you with a high-level understanding of the regulations that drive the safety of cosmetics. There are many misconceptions or myths about how the safety of cosmetics are regulated globally. But before we can dispel these myths, you will need to understand how cosmetics are regulated in various regions of the world. I will be focusing mostly on the US and the UK, EU, which I will refer to collectively as Europe, as many countries follow these regulatory schemes or use a hybrid of the two. Products are regulated as either cosmetics or drugs. This is an important regulatory distinction because the classification of a product drives which ingredients, use levels, and claims can be made about a product. Each country defines these classifications slightly differently. Generally, cosmetics are defined as beautifying or cleansing the body. You will note the slight difference in yellow between the US and European definitions. That difference is important because some products, which are cosmetics in Europe, are actually over-the-counter or OTC drugs in the US. Sunscreens are a great example to illustrate the differences between the two regulatory schemes, which I'll use over the next few slides. Sunscreens are used to prevent skin cancer or disease. In the US, each OTC product category is regulated by a monograph that defines which active ingredients must be used and at what levels, and what claims can be made about the product. Only those ingredients which are both safe and efficacious are permitted as drug actives. Safety of these ingredients are defined by the US Food and Drug Administration, or FDA, based on the recommendations of expert panels made up of doctors, toxicologists, experienced cosmetic chemists, and industry experts. Claims define whether a product is a cosmetic or a drug. Using sunscreens as an example, if the product claims sun protection or SPF, then it's a drug product. One sunscreen active, titanium dioxide, also has other cosmetic functions as a colorant, a bulking agent, and an opacifier. If titanium dioxide is in a face cream and the product does not claim SPF protection, then it is a cosmetic. And titanium is probably being used to perform another component, a function that is cosmetic. However, if SPF is claimed on the face cream, it is a sunscreen or an OTC drug. The monograph will define use levels and labeling requirements that must be maintained, like the inclusion of a drug facts box. The level of the ingredient that is used is important. For example, a product positioned as having anti-acne benefits containing the approved active ingredient salicylic acid must contain between 0.5% and 2% salicylic acid per the monograph. If salicylic acid is used at 0.25% in a face wash, for example, which is below the required levels, the product would be a cosmetic. If anti-acne claims are claimed on the product, it would be considered to be misbranded, which we will discuss later. The monographs also permit combinations of drug categories or active ingredients. If they are not explicitly listed in the monographs, then they are not approved combinations. For example, sunscreens and acne products cannot be combined. To further illustrate how claims drive the classification of a product and ingredient levels, you can use titanium dioxide as a colorant or a bulking agent in an OTC acne drug product, but you cannot claim sunscreen protection. Claims can also change the classification of a product in Europe, depending on the product type. For example, if on a diaper or a nappy rash cream you make the claim soothes baby's sensitive skin, it would be considered to be a borderline or drug product because you are claiming to be treating diaper rash, which is a medical condition. Acne is a word associated with borderline products, while blemish is a cosmetic term. Protect skin could imply a borderline claim, thus it must be qualified like protect skin from dryness to be a cosmetic claim. Europe does not use the drug facts box. Therefore, if you were selling a sunscreen in England, for example, you could not use the same labeling as you would for the US package. After classification, ingredients drive the regulations for formulas. There are 4 primary global schemes, although most countries do follow Europe. Positive lists mean that all the ingredients in a formula must be listed on a specific approved list. Australia does not allow some ingredients that are not on their Australian inventory of chemical substances, but there are still reporting requirements associated with using those ingredients. The U.S. has a negative list, meaning that no cosmetic product offered for sale can contain an ingredient on this list. Europe uses a combination of prohibited and restricted lists, which we will talk about more later. These lists define the use levels and conditions under which an ingredient can be used, as well as specific warnings that products must be labeled with. In countries like the US, Japan, Canada, and Korea, there are separate lists for OTC drugs, also known as non-medicinal drugs, natural health products, quasi-drugs, or special use cosmetics. In the US, there are 20+ ingredients in the regulations that are not permitted to be used in cosmetic products. Unlike Europe, we do not have a list of prohibited ingredients or approved preservatives. Instead, we have the overarching concept of adulteration, which we will discuss in greater detail shortly. However, the bottom line is that no product may contain an unsafe or poisonous ingredient or an ingredient that may cause harm to humans. During the development of the monograph system, the FDA and its expert panels have reviewed the safety of thousands of ingredients and have published their findings. Industry shares their studies on these ingredients with the FDA. Only those ingredients which are both safe and efficacious are included, as I mentioned earlier, and industry can see the FDA's opinions on ingredients that were found to be unsafe. Colorants, in my opinion, are more strictly regulated in the US than anywhere else in the world. Colorant manufacturers must submit samples of every single batch to the FDA for certification before they can be sold for inclusion in products. Natural colorants are not required to be batch certified. In Europe, the cosmetic regulations explicitly list the ingredients that cannot be used in cosmetic products. Ironically, many of these included ingredients have never been used in cosmetic products before. Annex 3 lists hundreds of ingredients with restricted use levels, use conditions, and in some cases warnings that must be included on the labels of products containing these ingredients. Approved colorants, preservatives, and UV filters are listed in Annexes 4, 5, and 6, along with their permitted use levels, use conditions, and required warnings, very similar to our monograph system. Ingredients sometimes are listed in multiple annexes. Salicylic acid, for example, is both restricted and an approved preservative. Titanium dioxide is actually listed in 3 separate annexes: restricted, permitted colorants, and permitted UV filters. How an ingredient is being used sometimes determines its level of restrictions and required warnings. The next logical question would be, how are ingredients determined to be restricted, prohibited, or safe for use? There are expert committees in both Europe and the US that continuously review the safety of ingredients. In Europe, the Scientific Committee for Consumer Safety, or the SCCS, reviews ingredients based on concerns in part by member states. SCCS opinions often result in the European Commission adding these ingredients to one of the annexes. Ingredient safety is also reviewed as part of the REACH program, which looks at environmental safety as well. The Cosmetic Ingredient Review, or CIR program, was founded in 1976 by the Personal Care Products Council, or PCPC, which is a U.S. trade association. They are, by the way, also the people who issue INCI names. This program was founded, though, with support from the FDA to evaluate the safety of cosmetic ingredients used in the U.S. Today, CIR is administered by the Expert Panel for Cosmetic Ingredient Safety. It's an independent, nonprofit scientific organization made up of scientists and doctors who are publicly nominated by consumer, scientific, and medical groups, government agencies, and industry. The expert panel develops safety assessment monographs and publishes these reports in the International Journal of Toxicology. To date, they have reviewed thousands of ingredients. The last piece to the regulation of cosmetics and drugs is the notification or registration of a product. The most important takeaway is that notification is telling the government of your intent to sell a product, and registration means you must get pre-approval from the government to sell your product. The government does not approve products that are notified. In the U.S., drug products must be notified within 30 days of placing the product on the market. The FDA does not approve OTC drugs because of the monograph system. If your product conforms to the monograph, you will need to notify the product each year. The manufacturer of the product must register with the FDA, and the brand, if different from the manufacturer, must receive a label or code in order to market OTC products. I've included Canada on the slide because they're a great example of a hybrid regulatory scheme. Health Canada maintains both a prohibited and restricted list. However, they follow the U.S. monograph system, but with a twist. Drugs require pre-approval in Canada. There are two categories: non-prescription drugs and natural health products. The term natural health products is used to describe substances such as vitamins and minerals, herbal medicines, homeopathic preparations, energy drinks, probiotics, and many alternative and traditional medicines. Non-prescription drugs are health products that can be bought without a doctor's prescription. Sunscreens in Canada, which used to follow the U.S. monograph closely, now have two separate monographs, one for primary sunscreens or beach products, and the other for secondary sunscreens, such as when a face cream claims SPF. Within each of these monographs, ingredients permitted for use as natural health actives are differentiated from those that are permitted for use as non-prescription drug. In Europe, a cosmetic product must be notified to the government. While the products need to be notified prior to the sale in these markets, the government does not approve the products for sale. Instead, a safety assessor must conduct a cosmetic product safety assessment that is a combination of compliance with the annexes and a paper toxicology review against a database of daily exposure limits that the European Commission has established. Microbial testing, stability, and compatibility results are also part of this review. Safety assessors must successfully complete a rigorous course and be certified to conduct these safety assessments. Once the safety assessment is complete and the product is found to be safe, the UK or EU responsible person, sometimes called a legal representative, reviews compliance with the labeling and notifies the product on one or both of the portals, and a CPNP or UK CPNP number is assigned. These numbers are needed to import products into the markets. Now that you have a basic understanding of how ingredients and products are regulated, I would like to switch gears and dispel some of the common myths around cosmetic product safety. The information I have provided thus far will help make it clear as to why some of these myths are false. If someone tells me that the FDA does not really regulate cosmetic products because they allow unsafe ingredients in cosmetic, I ask why they believe that. Typically, people say it's because the FDA does not maintain an extensive list of prohibited ingredients like the European Union. They will cite that the EU bans over 1,700 ingredients and the US only bans 20 or so. What people do not realize is that 1,200 to 1,400, or about 80% of the prohibited ingredients, were never even used in cosmetics. Just to give you an example, gasoline is listed on the prohibited list. Here again is where adulterated comes into play in the US. Rather than creating and maintaining lists of prohibited ingredients, the FDA requires that only unadulterated or safe products are placed on the market. If any one or more of these conditions listed on this slide are true, then the product is considered to be adulterated or unsafe for sale. So how does a brand prove that its products are safe? In the US, unlike many markets, the most common way is to conduct safety testing. If the safety of a product has not been reviewed, then this warning must be placed on a product advising the consumer of this fact. I challenge you to find a product that has this warning on its labeling today. Each of the tests listed on this slide address a component of the conditions under which a product is considered to be adulterated. During COVID, U.S. brands were forced to find qualified professionals to conduct safety assessments when in-person testing was not possible. Micro-testing, stability, and compatibility cannot be determined by any other method than actually testing the product. Which is why micro-testing, stability, and compatibility, as we discussed earlier, are required as part of the European safety assessment. The safety of a formula is based on the daily exposure limits of individual ingredients. The net result is that the safety is theoretical but based on years of industry data. Some markets, like the ASEAN countries, do not require the submission of any safety data in order to notify a product and place it on the market. This is because many countries copy and rely on the work that's been done in the EU. When I first meet a client, they'll oftentimes tell me that they do not need to conduct safety testing because they meet a retailer's clean list, or they have 24 free of claims, or they've checked their ingredients against a third-party rating system and they're safe. However, that's just not true. Safety can only be determined by testing or a qualified safety professional. In a minute, I will explain why this is leading to massive consumer confusion. This is also in response to the belief that at least the FDA does not appropriately regulate cosmetics. There are two parts to this myth. The first is that industry does not police itself, ensuring that only safe ingredients are used. We've already discussed at length how the safety of ingredients and products are determined, so let's look at this logically. There is no cosmetic company that could stay in business if they sold products that caused harm to their consumers. The consumer confusion that has been created around clean, safe, non-toxic, and natural ingredients and products is contributing to this myth, which I will discuss. The second part of this myth is that marketing claims are unregulated and therefore brands can say whatever they want on their products. This is patently false. In the US, anything that is false or misleading on the label makes the product misbranded, and the FDA can take action against the brand. There are multiple regulations that apply to cosmetic labeling in the US. The Federal Trade Commission, or FTC, regulates the made-in statements like made in the USA. Sustainability, which if found to be false, is called greenwashing, and endorsement claims. The FTC and the FDA jointly regulate the weights on packaging under the Fair Packaging and Labeling Act. Consumer groups, pseudo-governmental groups, and class action lawyers are consistently monitoring claims on advertising, websites, and packaging. Industry competitors even call each other out, so it does not make sense for a cosmetic brand to open themselves up to this type of scrutiny. Does it happen? Yes, but typically with brands that don't know better, and they often get found out. This is a result of both consumer confusion and the lack of official definitions of clean, natural, and non-toxic. In response to the free of claim trend, the European Commission began regulating claims using six common criteria. Legal compliance simply means that you cannot claim your product is free of a banned substance that is already banned. Truthfulness, while there are multiple parts to the simplest explanation, is if a product claims to contain ingredient, it must intentionally be added. Or if an ingredient would never be used in a certain product category, you cannot claim that it's free of this ingredient. So for example, if you say this product contains honey, honey must be one of the ingredients listed on the label, not honey fragrance, not honey flavor. If you're making the claim free of triclosan on a face cream, that would be considered against the truthfulness common criteria because triclosan is not used in face creams. Evidential support means that whether claims are explicit or implicit, they must have the appropriate support. An example would be if you make a 24-hour moisturization claim, you must have tested for this and cannot rely on any data found on raw materials to support this claim. Honesty means that obviously the claims are true. For example, if a product is tested as part of a regimen, you cannot make the claims on the individual product without explaining that the benefits come from using the entire regimen. Fairness means that you cannot use free of claims to denigrate a competitor's product if they choose to include those ingredients in their product. And finally, informed decision making means that a claim provides information which allows a specific target group or groups of end users to make a choice when purchasing a product. You see this most commonly in alcohol-free in children's products so that parents can choose products that don't contain alcohol, or vegan because that's a lifestyle choice. Often consumers do not know the technical or inky name of a common substance that may make them believe that companies are putting unsafe ingredients into their products. That's why oftentimes in inky names in the US, you will see in parentheses the common name coconut or banana. Criticism stems from the use of the term fragrance or parfum. This is not to say that it isn't driven by other ingredients. However, fragrances are very complex, and listing out all of the constituents would make the ingredient list unmanageable. I heard one critic state that 4,000 fragrance ingredients were hidden by the term fragrance parfum, and of those 4,000, 1,200 were known carcinogens. This is just simply scare tactics. We now list fragrance allergens on ingredient lists because they have been identified as a source of skin irritation. The example at the bottom right of this slide is a complete chemical makeup of a kiwi fruit. Some of the ingredients sound scary and could confuse a consumer that is not chemically savvy. This goes hand in hand with the fourth myth. Some ingredients that are natural in their pure form can be highly potent. As we just talked about, fragrance allergens are found in many essential oils, especially with natural ingredients. Their full safety is not often studied before placed on the market. It's assumed they are safe because they're natural. However, as time goes on, if there are issues related to irritation or else other things, then they're studied further, and as a result, they might be found to be unsafe, like what was happening with essential oils and fragrance allergens. For example, the fragrance allergens lirol and liliol have been banned and are found naturally in chamomile. Minerals, which are often used as natural colorants, can be contaminated with heavy metals. Conversely, there are synthetic ingredients that have very high safety profiles but have been demonized, again, due to the lack of official definitions of clean, safe, and non-toxic. I saw one website that claimed that all vegan products are cruelty-free, better for sensitive skin, and always made of 100% natural ingredients. That's just not true. The product could be 100% synthetic, have had ingredients in the past tested on animals, and still be vegan. So why all of these myths? The bottom line is fear sells, and in the absence of official definitions, various groups have used fear to get rich. Many of the misconceptions related to the safety of ingredients can be traced back to NGOs, at least in the US. But as industry, we have taken advantage of this, and the result is we have helped to create consumer confusion. I'm not going to dive in on bloggers, journalists, and influencers, except to say that fear sells. The Not So Pretty docuseries was very one-sided, not fact-based, and filled with fear tactics. I suggest you listen to the podcast that Jen did on this series. As to scientists, I have seen numerous times a single study which has not been validated has been used to discredit ingredients so that the researcher can find notoriety. I'm sure we can think of a few examples. Environmental Working Group, or EWG, has a certification program. It's one of those third-party certification programs that people look at when they purchase products. It's a pay-to-play scheme that basically says you are compliant with the EU's prohibited list and that you follow the FDA's regulations. In 2018, they took in $14 million in donations and a few additional million as part of the certification program. And the rating system that is associated with products is not based on sound science. In an article published in the Journal of the American Medical Association by Drs. Rubin and Broad, they wrote the following. The EWG Skin Safe database scores thousands of products based on the putative toxicity of their ingredients, but these claims are not always uniformly agreed on by a broad consensus of experts and can cause consumer confusion. For example, the EWG assigned a hazard score of 5 to PEG-2-soyamine, despite acknowledging that there is no available data. Although the EWG remains a powerful force driving the clean beauty dialogue, their method for assessing risk does not seem to be data-driven. The EWG also profits from participating in affiliate programs where they may receive a percentage of the sales when a consumer makes a purchase through their website, which is a notable conflict of interest. Next, retailers. They have created their own clean list. Here is a comparison of Credo, Ulta, and Sephora. I know it looks like an eye chart, and I apologize, but look at the inconsistencies. How does one meet all of the cleanness, and which one is backed by science? Which one is correct? Credo has banned all ethoxylated ingredients, for example. The concern is over 1,4-dioxane contamination, but what about those raw material manufacturers that have found a way to remove 1,4-dioxane contamination in their products? And there's a safer version. Are they now banned? Another issue is that some of these banned ingredients are what make a product efficacious. And while the industry is working on it, cosmetic science is still catching up and may have not found a new solution that's safer and better. So the net is we will have safe products with good values and ethos that do not work, and then the consumers will demand efficacy, a return. As an industry, we are not helping ourselves. Brands are creating their own definitions of natural, clean, non-toxic, safe, green. Either because they do not know better or they think it costs too much, brands are certifying themselves and making up symbols that are designed to look like those from independent third-party certifying bodies. In the next few slides, I will show you how brands are creating fake certification symbols that are contributing to consumer confusion, particularly around safety, vegan, and cruelty-free. Here's where the real consumer confusion begins. Many websites and labels carry these symbols. Not one of these is official. Just look at all the beaker symbols: paraben-free, synthetic fragrance-free, PEG-free, botanical science. They all use the beaker symbol. Now just look at all the symbols for paraben-free: a leaf, a beaker, 2 different molecules in a plant. So you can see how people would be confused. So here are the various symbols that are used for vegan. Now this poses yet a different problem because actually many of these are official symbols. The problem is that some countries have multiples. 13 of these 24 symbols are theoretically official. 3 of them are from Italy and 3 are from the UK. The problem is that no government-sanctioned vegan organizations are providing an official definition. These are all non-governmental organizations or registered charities that are independent and do certify products. However, there are so many combined with false symbols that it's hard to discern which are truly official. Here are samples of cruelty-free symbols. Do you know which ones are official? There are only 3. These 3 are the only official symbols, but they all look very similar. So you can see how the consumer would think many of these brands have received official cruelty-free certifications when they have not. As an industry, we do try our best to make products that are safe. How can we be better? Well, the US FDA could provide more specific guidance to brands, especially new brands that are not familiar with the regulations, so that they can make better decisions in selecting safe raw materials and ingredients that will not harm the consumer. They could do a better job with enforcement and stop those very few bad industry players that don't follow the rules. The European Commission could help by streamlining all of the annexes to make finding all of the restrictions on a single ingredient easier to understand for its safe use in cosmetics. Thank you for your attention.